My name is Suresh, one of the directors of Earthians and Craft Interactive. Essentially, these two companies are focused on healthcare and ERP Next solutions. Earthians, some of you must be knowing that it was bootstrapped in 2012 as a product and service company by two brothers, Anup and Ranjit. Unfortunately and sadly, Ranjit is no more with us today. Earthians initially focused on healthcare app, but the team, there was a bit of a challenge for the team to focus dedicatedly on the domain itself because they are mostly dependent on ERP related services. We realized that and we segregated these two companies separately strictly. Earthians focus on healthcare and Craft focus on ERP Next. Since then, Earthians started aggressively focusing on taking projects as well as the product development. And we are immensely grateful to Frappe team, the community and the clients who helped us to develop the product and enhance it also. There is a recent development, I'm sure many of you must have noticed in the announcement in the forum and the social media. Or those who are not aware of it, I'm privileged to announce that there is a transition of ownership of Frappe Health to Earthians in the new name Marley Healthcare. Now, the name, why Marley? There is a connect, or rather we established a logical connect to it. You all know Bob Marley. He envisioned a world filled with peace and love. This is somewhat resonate with Earthian's philosophy, which is a community without boundaries. Number two, Bob Marley was a coffee lover. And there is a brand exists in his name. And you all know how to connect coffee with Frappe. The reason, the logic we connected or the purpose of moving is, it signifies more than the ownership change. It represents a new chapter for us to maintain the product and enhance the product. And we assure you, the repository remain well maintained in the safe hands of Earthians. Yes, it's a long way to go, but we will make it. Essentially, going forward, what we intend to do is create a community, healthcare community, along with Frappe and ERP Next, to support the healthcare facilities across the world. As a strategy of improving continuous improvement of our product, there are new few features have been added in the product. My colleague Aravind will take you through that. And thank you so much everyone's support, and especially Frappe for the support and the opportunity. Thank you.
Thank you for the introduction, Suresh. Good afternoon, everyone. My name is Aravind. I'm a software developer at Earthians. My journey into the world of Frappe started around 6 months ago, which is enough to see the potential of a truly open source ERP, especially in India, where even the smallest of retailers are increasingly being encouraged to digitalize their businesses. This opens a lot of doors for Frappe across various domains, and in the field of health, we are contributing through Marley Healthcare. I'm excited to be here today to share some of the new features we are bringing for the upcoming version 15 update. So let's get started with the first one. As of now, if a hospital that uses Marley has to deal with a patient who has an insurance policy, it will have to be done manually. The calculations will have to be done by a person. The total amount and billed amount and the insurance amount will have to be reduced. A lot of processes are involved. It's a tedious flow and a huge inconvenience. In order to overcome this inconvenience and to streamline the processes related to insurance, we have added the insurance module with the following doc types. The insurance payer is a list of organizations that pay insurance on behalf of the patient. They are basically insurance companies. Insurance payer contract defines the active contract period between the hospital and the insurance payer. Insurance payer eligibility plan is a list of actual products offered by the insurance payers, the policies that people subscribe to. And item insurance eligibility are the list of items and services offered by the hospital to the patient and that are covered under various insurance payer eligibility plans. The rest of the doc types are covered in the workflow and we will see them in the coming slides. So this is the basic workflow diagram of the insurance module. The patient appointment, that's where we start. And at the end of the flow, when the hospital finally creates an insurance claim to get approval from the insurance payer, and when they receive the payment, the flow will be completed. I will explain them one by one. When we create a new patient appointment, there is the option to select the patient's insurance policy. If the insurance policy details of the patient are not already fed into the system, we can create a new policy. In the new insurance policy page, we can select the patient. We can provide the insurance payer and plan details, which are selected from the previous doc types I explained. And we can give the other details like policy number, expiry date. And once we save this, we can submit the patient appointment, and then we go on to the patient encounter. This is the scenario where the patient meets the doctor. And after consultation, the doctor might recommend some medications or lab tests to the patient. Some of these lab tests might be covered under the patient's insurance policy. And against each of these lab tests, once we submit the patient encounter, service requests will be created. Once the patient receives the services from the hospital and the service requests are submitted, we will create new documents against each of these services known as patient insurance coverage. Patient insurance coverage is the doc type that can be considered as the core doc type of the insurance module. It is in this doc type where all the insurance details regarding a patient and the items offered by the hospital, which are spread across various doc types, are collected and seen from one place. In sales invoice, we use the patient insurance coverage documents to fetch all the insurance-related data of a patient. Once the patient insurance coverages are approved and submitted, we can go to sales invoice, select the patient, fetch the services received by him, and each of these services will be added as item in the sales invoice. And against these items, you can see that along with the actual rate of these items, the amount covered by the insurance policy will also be displayed. All these details are fetched from patient insurance coverage. Once we submit the sales invoice, we can see that the status will change to partially paid because a part of the total billed amount is considered to be paid by the patient insurance policy. The rest of the amount can be paid by the patient. We can create a payment entry, and then we move on to the insurance claim. Insurance claim is where the hospital requests for approval and payment from the insurance payer. We can select the patient details, payer details, the policy, and once we provide the time period between which the insurance coverages have to be fetched, we will get such a child table. We can save this insurance claim, and then we can wait for the insurance payer's approval. Once we get the approval, we can update the claim status. And once we receive the payment, we can create a payment entry from the insurance claim. Once we create the payment entry, the details of the transaction will be shown in the ledger, and it will be made against the insurance payer and not the patient. So that was about the insurance module. Next, we move on to patient portal. Thanks to Frappe UI and Builder, we are now able to provide a better portal for patients. We are still working on the UX, but since it is coming out as part of the next update, we thought maybe we can take a peek into it. It's a website feature that lets patients register themselves and book appointments without depending on the hospital. After providing personal details and contact details, you'll be taken to the book appointments page where the practitioner can be selected based on their departments. And once after choosing the practitioner, you'll get a calendar view to book the date and time, and the appointment can be booked. We introduced the diagnostic module in version 15. We are showing it here because we have refactored it and some new changes are added to it. There are people who still use the older lab test module, which is working, but there are some limitations. In the new diagnostic module, it is possible to create samples depending on the sample types. And we have also added a new feature called Diagnostic Report, which allows to collect many samples and print results in one go. The diagnostic module workflow starts with the sales invoice. In the sales invoice, we can add the tests to be done on a patient as items. And some of these items might have multiple samples to be collected, as in the case of liver function test that is being selected here. Once we submit the sales invoice, make the payment, we can go to sample collection. In the sample collection, we can see all the different samples that has to be collected for this one particular liver function test. Once the clinic or the lab collects these samples, they will mark them as collected. They will submit the sample collection document, and then against each of these samples, observations will be created. There are two ways to go from here. They can either go to each observation separately, or they can use the new diagnostic report feature. The diagnostic report is a custom doc type which allows the user to provide all the input sample data in one go. After entering data, they can approve them separately using the buttons on the side, or there is an approve button at the top where they can just go ahead and approve all of them. After submitting the diagnostic report, there is the option to accumulate all this data on 1 or 2 pages, and it can be printed. This is one such custom-made PDF that we have created for one of our clients. All the different sample data is collected in one page. You don't have to go to each observation separately. Ayushman Bharat Digital Mission milestones 2 and 3. So this is a feature which is limited within the region of India. ABDM, or Ayushman Bharat, is a project by Government of India to create a digital health ecosystem in the country. It aims to provide health IDs for all citizens so that hospitals, insurance firms, and other players in health sector can access these health records electronically. The ABDM ecosystem is centered around citizens and patients. They are the primary stakeholders of the project. And on the right side, you can see health tech companies. As tech providers to health service providers, we form an important link in the ABDM ecosystem. And to aid us in creating the softwares and tools to make ABDM a reality, the government has provided us with an environment for testing and developing known as the sandbox, using which we have successfully implemented milestone 1 of ABDM. We at Earthians are committed to implementing ABDM, so we are moving ahead with milestones 2 and 3. ABDM milestone 2 is about linking newly created health records to existing health IDs. There are 3 methods to do it. HIP initiated linking. HIP stands for Health Information Provider, basically any hospital, clinic, or other healthcare organizations that can create or exchange healthcare data. In HIP initiated linking, the hospitals need to have access to the patient's health ID. If they have that, then using a linking token obtained at the time of registration with the ABDM, if they are authorized, they can link the health IDs with the patient records. And in case they don't have access to the patient's health ID, they can use the second method, notification to mobile. In notification to mobile, they will have access to the patient's phone number. And when a new medical record is created in the name of this particular patient, it will be notified to a system known as HIECM, which is Healthcare Information Exchange and Consent Management System. It's a collection of APIs at the ABDM. And once the notification is obtained at the HIECM, it will send an SMS with a link to the patient's phone number. On clicking the link, a PHR app will be triggered on the patient's phone, which can discover the new health records made for that patient. And using the PHR app, maybe like Arogya Setu, they can link the health ID with the newly created health records. There is also a third method, discovery and link, where the patient can use the PHR app to discover new health records without wanting a link from the HIECM, but that's not in our scope, so we are moving on to milestone 3. Milestone 3 is about developing health information user services. It's about providing health records to healthcare workers. Whether if a doctor needs health records of a patient during consultation, then we have to provide these health records to these healthcare workers. And this happens in 2 stages. First, the healthcare management system at the hospital has to request for consent from the patient to access the health records. And once the consent is obtained, they'll have to send a second request to access the health data. At the healthcare organization, at the hospital, when the doctor requires the patient's health records, a consent request will be sent to the HIECM. This will be forwarded to the patient's PHR app. And if the patient wants to provide consent, he will have to enter a consent pin in his PHR app, will be sent back to the HMS at the hospital. Using this consent pin, a second request will have to be made to the HIECM. If the consent pin is verified, then the HIECM will fetch the health record and it will be sent to the HMS at the hospital and it will be encrypted, so there will be no data lost in transmission. FHIR stands for Fast Healthcare Interoperability Services. When multiple systems are involved in health data exchange, it is necessary to have a common standard and format. FHIR is such a format developed by a community known as HL7 and is universally accepted. Some of the advantages of FHIR are, first, it's human readable. On top of being easily interpreted by machines, since the keys and labels used in FHIR are very similar to human language, people can easily understand it. The National Health Authority of India mandates the use of FHIR in ABDM. So that's why it is linked with ABDM. In FHIR, the data is sent as bundles. Bundle is a container that holds many pieces of data under one key. This is particularly useful in ABDM as there can be many different types of health records for one patient. For example, a patient can have lab record, lab test results, inpatient record, diagnostic reports, etc. made in his name. And if they are stored as FHIR bundles, all this data can be linked to a single key, that is the health ID. We are integrating FHIR to Marley Healthcare with the option to turn it on or off based on the region. So on top of these features I just explained, we are also bringing new stuff like patient history based on FHIR resources, patient conditions, improved patient workflow, RIS integration, and all these will be included in the coming update. So check it out after the release by end of November. If you have any questions, you can ask it now. No. Or you can ask it later. We will be here. So you can visit our GitHub profile to explore more of our work. We have a Telegram channel where we give updates about the product. You can you post their queries there, or you can connect using email. So thank you to Frappe team for organizing such a grand event. Thank you for inviting us and providing us with a platform to share our ideas. This was my first time attending Frappeverse or any open source event for that matter. So I'm grateful to my colleagues at Earthians for believing in me and choosing me to represent them at this stage. Thank you. Have a great day.